Cool. Now, we are competing with a lot of noise here today, so I really hope you can hear. My next question to each member of the panel is, can you tell me why you got into research and how you first got started? What was the trigger that got you in there, and what sort of leg up did you need to get started in research?
When I was doing anesthesia training in Ireland, that was a very, very standard part of our training scheme, as the insistence and requirement of doing associated academic activities with your clinical work. So I've always been, we were doing all types of audits and surveys and types of work that took a lot of time, but maybe didn't provide the awards that they were happy with as a training scheme. So at the time I signed up for a master's degree kind of just to fulfill that requirement. However, then I really got interested in it. It was lovely to do and, you know, very exciting, and I loved doing it. So I kept going and finished that degree. And then when I arrived here in Australia, there was a few questions that needed answering and a few presentations that needed doing. And to be able to do those with the additional support that the higher degree then offered, that was kind of a no-brainer to sign up for that then.
Yeah, it's a tricky question. I think when I was going through my registrar training years in Sydney, I'd had a couple of supervisors who were academic surgeons, because it's not always been a strong forefront in surgery, who had recommended, oh, you should do a PhD, you're sort of, you know, academically minded, think about doing something like that. And I thought, oh yeah, sounds interesting. And a few sort of projects came up and I just never quite thought they were where I was headed. And then I got really busy with clinical work and trying to finish my clinical training. But then during my clinical training, one of my medical students who'd I'd been supervising had asked something about colorectal cancer. And he wanted to do a paper on this really specific topic in colorectal cancer. And he'd asked about a type of statistical technique of doing that. And so I then did a master's in that statistical technique. And that kind of just, you know, that ended up being the focus of what I thought. In the end, I want to be able to answer that question, knowing everything about that technique. And so went and approached it that way. And then since going through that process, as I'm sure you've probably heard lots today, during that process, you meet people and you collaborate and you get other questions and you get other opportunities to be part of other research projects. And you learn a lot about what you do, and you learn a lot about how a lot of what we do clinically doesn't have great support and doesn't have great data. And so how can we make that better? And how can we do a better job and get better outcomes for our patients? And I think, you know, it ends up cascading a little bit in that way, which is part of the second challenge, which I'm sure we'll get to, which is then how do you put the brakes on that and not just keep going? Because clinical work can be quite well defined. You know, you have work days which, you know, eventually end. But the research part of it is just like a big black hole you can get stuck in and never find your way out. And you can lose a lot of time if you're not very, very disciplined in how you approach it. And I'm still really learning that.
So yeah, when I was at medical school, I worked as a car park attendant 1 year, and then worked as a DJ for weddings. And then I saw the Royal College of Pathologists had a medical studentship for doing research. And I thought, I'll do that instead this summer. Instead, you know, the hours are terrible, and being a DJ. And so I really got that experience from being a medical student at Peter Mac, working in a cancer research laboratory. That was my sort of first insight into it, and I really liked it. And I thought it was, you know, it's a bit like playing in a men's shed. You know, with you've got to do things very technically, but it's very rewarding when things work. Doing PCRs and very technical things really appealed to me. And the data that you produce can be really important, and particularly if you have a supervisor that really values the work that you've done and you see it being published and getting cited, it gives you a bit of a buzz to feel that you've contributed to greater knowledge, and you know, ethically as well, it sits quite well. You know, everybody went into medicine to help people, and you can really help potentially a lot more people by doing research than you can by seeing patients one at a time. So I think that's why I keep doing it.
Okay, now there is an opportunity. You can all ask questions if you want to. So if I'm not looking at you, just stick your hand up and you can have a question. So here's a question. Can you ask it into the microphone and nice and loudly so your colleagues can hear as well?
So it seemed like a good opportunity to ask this question when you're talking about how you got into research and learned about it and got kind of hooked. As a second-year medical student, I'm going, okay, I've got a lot on my plate as it is. What further advantage or benefit in terms of career progression would you say adding a master's degree or a PhD onto that would render?
Great question. So who wants to take the first crack? You did a master's degree as you were going through, so why don't we? It's up to you.
There's probably a two-barreled question, because competitively, it's unfortunately becoming quite competitive to apply for registrar and consultant jobs. And on the other hand, I think if you start trying to achieve that at the end of your medical career or your medical degree, you already have colleagues who've achieved some things, and you know, the ideal situation is to start small and do something every year. Every year I have usually apply for one scholarship student from UQ, and I answer this question quite a lot. So if you do one project every year, I think you're already ahead of your cohort. I don't necessarily think you have to always do a master's degree with your medical degree. There's some people who do that, but that is quite a wild thing to do. But even just doing a research project, getting involved with something every year, that will put you ahead of the rest of your cohort.
Yeah, it opened my eyes, because going through surgery training and as a junior doctor, the surgeon scientists or the academic prof surgeons were always the bad clinicians. No, that's not true, but that was what it was always sold at. You know, you did academic surgery if you were a bit of a rubbish surgeon, and it was never true, but it was always the kind of a selling point, I think, of all the surgeons who couldn't be bothered doing research, because it's really hard to balance it up. And now that's really swinging back the other way. And I think the academic side of surgery, the surgeon researcher, is really getting more and more valued. And it's also because often research and teaching go hand in hand. And I think there's a lot of value in the fact that we can sit with other students and we can have lots of different levels of student and registrar and fellow, and try and approach them with different ways of teaching and learning. So I think if you want to just get into solo practice or a small clinical practice somewhere, do some minimal hours or work in a sort of really structured and defined way, then probably you don't need to do research and you can do happily what you want to do. If you want to be more in-depth involved in teaching, if you want to be more involved in how the university goes, how your medical school runs, if you want to be more involved in how your department runs, or be involved in an administrative way in your hospital, if you want to be invited to meetings internationally within your specialty, if you want to travel more within your specialty, all those things, internationally especially, recognition. If you don't have prof or a prof in front of your name, they're reluctant to invite you, because internationally it's much more meaningful, or it is very meaningful for those things. So it certainly opens a lot of doors, which I didn't realize when I was going through. I would certainly agree with Michelle. I think doing through medical school, if you've got a really well-defined idea already, fabulous, like approach a higher degree. I think that's absolutely fine. If you don't quite yet have a great idea in mind, then start with some small projects, and they often do snowball really well, especially if you can find a good supervisor or an approachable supervisory team who will just sort of angle you in the right direction. So big opportunities. I think it's been really valuable when I came to it very late, certainly not in med school, but much later. But not an essential, but yeah, valuable, very valuable.
I mean, it's certainly a higher degree was, you know, makes you more competitive when applying for specialty college training positions. That's definitely true. Most of the specialty training colleges, particularly all the pathology specialties, have research as a component of the training program. So it is a requirement that you do some research during your training anyway. The College of Pathologists has a research pathway for each of its specialties. And so pathology is a very broad area. The anatomical pathology, which is what I do, that's tissue diagnostics, but there's chemical pathology, microbiology, hematology, genetics, hematology. They all have research pathways that give you some training credits for doing a PhD during your training. You don't necessarily need a PhD to get into training programs, but experience in research definitely helps. And particularly research that is aligned with the specialty or areas of interest that you want to do is, but then I'd say things like lab research has a lot of overlap in the different specialties. You know, gastroenterology lab research isn't that much different to cancer lab research, which isn't that much different to any other lab research. It's all sort of similar skills. So yeah, I think it is very valuable getting experience, and the sooner the better, I think. Yeah.
Oh, there's more questions. No, come up and ask a question. Nice and loud.
So how did you enter the pathway of pathology? Because like lots of courses weren't offered or like limited offer in university, like undergrad. And like for pathology, there's only like several lectures in my anatomy course and that's all. So how do you actually end up doing that as your specialties?
So you're right. I think most medical schools around Australia have really cut their pathology curriculum down to the bare minimum. And to be honest, you know, to be a lot of, you know, well, it's a controversial statement, but okay. You don't need to have a particularly in-depth knowledge of pathology to be a good doctor, I suppose. But it definitely helps if you do know more about pathology. It really is the fundamental basis of medicine. And so I do find that pathology doesn't have a very high profile amongst people finishing medicine these days, and it isn't often considered as a good career choice by medical students. You can always approach in the public hospitals, the pathology departments or the pathologists to come and get experience in the lab. We love it when people say that to us and come and we do tutorials for everyone doing surgical rotations at the Mater. If there are people that are interested, we will come in. I have a medical student at the moment who works in our laboratory, employed as entering specimens. And I think that's a much better use of their time than what I did, which was working in a car park. So, you know, there are a lot of opportunities, potentially, you just have to find them. And you can enter the pathology training program anytime after HMO2, so 2 years of clinical medicine you have to have. There are other pathways though. So we have a number of pathology specialties that are dual trained physicians. And so hematologists are often physicians and they work in the laboratory. So they have positions both in the lab and in the hospital, and that's a really good mix. That's the same with microbiologists and infectious diseases. Some genetic pathologists are also pediatricians. Anatomical pathologists, well, we don't do anything else because it's so complex and so hard. But I think showing an interest early on is the way, if you're interested, to get involved. Yeah.
Right. Well, I've got two people here who've been overseas for their medical training and one who's currently out of their home home country. What is it like to travel as you train? And I've noticed that even when you are a qualified, say even like a consultant here in Australia, to do something in Canada, say, there's a long process of applying for jobs and for accreditation in another country. So what's the process of transferring from country to country while undertaking medical training?
Look, it's different depending on where you want to go, and different depending on what level of autonomy you want to have when you get there. So if I want to go to Canada tomorrow to work as an HPV surgeon, then it's a big rigmarole, unless I'm invited and sponsored and all that kind of stuff, in which case it's just very slightly less of a massive rigmarole. But to go as a fellow, a trainee, a medical student, it's usually not too challenging. I mean, the most difficult thing for me going to Canada was getting visas, because you're sort of in that gray zone where, especially in North America, a lot of the training programs are through universities, which actually makes it a lot easier because you're a student effectively of the University of Toronto. And so student visas work well. As you go to be employed, it becomes a challenge because, you know, when the UK joined the EU, then going to the UK to work as a clinician became a little more difficult, not horribly so, but a little more difficult. So it's really individual, but it's actually not too bad unless you really want to pick up and move your whole life and your whole practice and your whole clinical work somewhere else. To do it while you're training is really good and a really great time to do it. And if you have a connection with another country already, you know, a lot of Australians are immigrants from elsewhere, you know, going back home for a bit of time or going to a country that your partner or your parents were from or whatever is also, you know, always a great way of just exploring while you're training. And even if we often have students come to Australia, or we send students overseas for, you know, summer clerkships and summer projects and things like that, it's always good to see another country and expand your horizons that way.
Yeah, sure. I think it's great value. I have been in contact with so many people who've worked in different places. It can always add to your clinical ability, to just your ability to cope with a lot of differences. There's a lot of challenges, obviously, that comes with it, but it broadens your life quite significantly to work in different countries from a clinical perspective, but just from a personal perspective as well. There's no easy way to go from one country to another, and everyone will have their own requirements. The first thing would be the language barrier, I'd say. You'd need to kind of pick a country where you can speak the language, and then you pick a country where your qualification at the time where you are is the most transferable. And then you go from there to maybe make contacts or so. You always will have to step a little bit down from where you were before, but in the end, that will be great value. I would never have done anything that different if I had my life over again. I would move all countries again, but it definitely is not an easy thing, and there's a lot of admin and a lot of paperwork. And if you do that early in your career, when you don't have a family or your other half is not attached to something yet, or the later on in your career, the harder that becomes to change or to move. And you can just go for 6 months or for a year. You don't need to go and make a career in another country as well. But for your CV, for a lot of other reasons in your, you know, just your clinical work profile, I think that's a great benefit.
Yeah, I think, you know, when you're junior, it's a lot easier and there's a lot of value in doing things overseas. When I went to UK, I didn't register with the GMC because I'd been a pathology registrar for 2 years, so I hadn't seen patients, and I would have had to have sat the PLAB and all this exam stuff, OSCEs. I couldn't be bothered with anything else, so I just took time out of training to do a PhD, and I wouldn't be scared of doing that. It's really good to immerse yourself in the experience, and just to, you know, I thought that was a very valuable experience for me to just do research and nothing else for 3 years. Put in crazy hours and just work all weekends and do the sort of experiments that take weeks. So that was great.
So a theme we touched on this morning with the older generation of people was around the concept of mentoring, and whether or not mentoring is a worthwhile experience for people when they're early in their career trying to learn the ropes. So I just want to ask each of the panel members, have you had mentors yourself, people you've looked up to, or people who've taken time to show you the ropes, take you along and show you the path? And if you have had mentors, how do you know if they're good or not good? And what are the things that people should look for in a good mentor?
Wow, that's a really difficult question. Yes, absolutely. I've had mentors, not only one, many. I don't think you can do this at all just by yourself. You have to learn from someone every step of the way that you go. To choose a mentor, that's nearly impossible. You know, someone who's really good at achievement is not necessarily always good at giving you the credit for your work that you've done. I often say, if you're a junior, try and get yourself involved in a project that's already going, and maybe with someone that's previously provided some credit to people who's worked with them. It's really difficult to choose such a, someone, and you also get lucky at the people that you meet around. Always just treat everyone with respect, no matter, the more the respect you treat others with, the more they'll give to you.
I had some good, very informal mentors early on, and I think at different times in my career, was for very different things. Initially, I think, my first mentor was someone reasonably close to me in sort of age and hierarchy, I guess, for want of a better word, because I really wanted someone to sort of talk to me about how to get through clinically, because that was the real struggle at the time. How do I get my exams done? How do I learn how to be a really technically good surgeon? And he was fantastic at that. But I would never want to learn work-life balance from him, because he was awful at that. And also not a great researcher. And so then to learn that off somebody else was, so I think definitely there are some programs have very formal structured mentoring programs, which can work well. But I think it's more, I think I've just tried to identify people who I've worked with who've really gotten some part of their career down that resonates with me. And I feel like, okay, I really want to operate like this person, but I really want to talk to patients like this person, because this woman is wonderful, and the way she talks to patients is brilliant, and she can get through to someone really complex ideas really well. Teach me how to do that, because that's really good. So everyone's got a little bit of something different, and I think you need to, to be honest, that's probably a skill to learn, is looking around you and keeping your head up and thinking, trying to find people who may not be the absolute best at everything, or may not be the most popular or most high strung of all the people out there, or even the highest at their level, but who just seem to have a really good skill set that you want to learn. And most of the time those people are really interested to teach you it as well, especially if you show interest. So I've been really lucky, had some really great mentors, and have tried to be a good mentor back. And again, it's hard, because I know there's some students or juniors who have wanted different things at different times, and some things I've been much better at teaching or passing on than others. And I think also recognizing in myself when someone comes and says, hey, can you show me about this? And thinking, well, you know what, you're probably better off than going see this person, because that's probably not what I'm best at. And but it's a skill. I think it's certainly been part of what I've learned as I've gotten more senior.
Yeah, I think for me, the most value I've had is out of informal mentors. I think Marta Research a few years ago had a very formal mentorship program where you would get matched up with someone else, but I found that whole experience just quite awkward. It's not very natural. And so I've had great mentors who have been my PhD supervisors and supervisors of training. But I think it just becomes awfully awkward once you say you're my mentor and pin them down. So it's more always been an informal way of being, so to speak. Yeah.
Now, I am very conscious of time, and I know people have to get away and have other things. I'm just going to have one last question with our panel, and it's really a bit existential, but what advice would you give to your younger self? If you were looking back 10 years ago to yourself as you were contemplating a research component to your clinical career, what would be the advice you would give now with the benefit of where you are?
I think don't assume that anything is going to come easy. You're going to have to work very, very hard at this, and take the opportunities that you get as you go along. Never give up. Keep going and going until you get done what you want to do, and treat everybody with respect.
Yeah, I think that last one's so important, isn't it? You just meet so many people when you're training, and you just never know when, I mean, being selfish about it, you never know when that person might be the right person to help you at a particular time down the track, or when they're going to be a great colleague or something like that. And I think part of medicine is hierarchical, but it's always really important never to, to always be aware of that, and to always treat your juniors, your seniors, everybody, the nurses, the wardies, respectfully, because you just never know what you can learn from them at any particular time in your career. So I think that's really, really important. Really simple thing, I think, if I look back, is I would have just to write more. I mean, I've never realized just how, how long it takes to write a grant proposal, how long it takes to write, I think if I had started writing papers and grants and things 5-10 years earlier, I would be a much happier person today, because it really is a skill, and then cut and paste becomes a really good skill. And but you have to have learned a lot before you can cut and paste successfully. So I don't want to break research down into cut and paste, but a lot of it is really cut and paste. No, but yeah, write more, because writing is such a great skill to have. I think you just got to do it early, and lots of it.
Yeah, I think I would say go and find opportunities. They're not going to just land in your lap. You have to go out and find the fellowships, find the scholarships, find the money, and just get out of your comfort zone and approach people and say, this is what you're interested in doing. It's very easy to just coast through, and through medical school and being an intern and a resident. But unless you take the initiative early and take early opportunities, it becomes harder later on, I feel.
Fantastic. Well, I think you've been treated to some words of wisdom there. This has been a fantastic panel, honestly. Thank you, Michelle, David, and Cameron.